It's a pleasure today to introduce our speaker, Dr. Olivia Gould, who is Institute Fellow at the Urban Institute. About a decade ago, I don't think I told you this, but about a decade ago, I read with horror a series of stories in the Washington Post, the Breonna Blackman stories. This was a young girl who was killed by her mother, and that death could have been preventable had the agency that was responsible for her care, at least indirectly, had done a better job. But of course that agency faced the kind of problems that most social welfare agencies in this country face: inadequate funding, not enough caseworkers. But it also was a very poorly managed agency. The administrative staff were spending money improperly. It was under a court receivership, which made it very difficult to have sustained leadership and political accountability. That kind of situation, while it was really tragic in D.C., is rather common across this country with child protective services agencies. I actually used these stories as a basis of a case in a government budgeting course for graduate students, and we talked about all the different things you could do and the kind of difficult choices you would have to make. And actually, I didn't revise the cases for a long time, even though the agency itself improved. Several years later, while the Post did run the occasional story about tragedies with children, they also documented that the agency's performance had improved greatly. And one of the reasons why that happened was because of our guest's effort. Olivia Gould was appointed as director of that agency by Tony Williams. Tony Williams was the mayor of D.C., and he was a foster child himself, so he had a personal involvement in improving that agency. But he made an inspired choice in picking Dr. Gould as the head of it. Prior to that, she had been a leader in the Health and Human Services Department for 8 years and helping to run the Children and Families programs, including Head Start, Early Head Start, and related programs. Before that, she had worked for the Children's Defense Fund and for Human Services in Massachusetts, and she also taught at the JFK School of Government at Harvard, from which she also earned her PhD. A couple years ago, I was at the Urban Institute and happened to be seated next to Olivia just by chance, and she told me she was writing this book called Reforming Child Welfare about her efforts to lead reform in D.C. and about similar efforts in a couple other states. And I thought at the time that the book would have the potential of filling a big gap in the policy and management literature, which tends to either focus on policy or on management and not connect the two. And what she's done here is a really good job of connecting the two. So it's a sustained, it's a review of how sustained leadership and intelligent management could help people deal with difficult policy challenges, particularly in agencies that aren't working too well. For those of you who are interested in looking at the book and perhaps buying a copy, there's some order forms back there. I should tell you, when Bob Reischauer was here at the Urban Institute, he was very pleased that we were offering the book, because one of his budget challenges is having an Urban Institute press these days. Is who makes money printing books. So today Dr. Gould will talk about her experiences and her suggestions for reform, and I also understand she's going to connect these ideas to yesterday's momentous vote in the House on comprehensive health reform. And I'd like to pause here for applause in case anybody wants to applaud. In any event, after her talk, we'll have time for questions and answers, so please join me in welcoming Dr. Gould to UMBC.
Good afternoon. It's wonderful to be here. I want to thank Dr. Myers and all of you. I spent some time earlier today talking with students from the Sondheim program, some of whom I think are here, and I'm just enormously impressed with what you're doing here in terms of the commitment to a range of public policy issues and how to make a difference on them. I was particularly thrilled to be invited at a time that I think is so important for the country and for states and for cities within the country, when there's such a mix of enormous challenges to policy, most particularly a deep recession that is causing deep distress to families and communities everywhere. I'm sure you're seeing it in Baltimore and in your own studies. But that distress combined with such a moment of opportunity, for me, yesterday's vote represents one example of that opportunity, but a new president bringing new ideas and new ways of thinking about things. So that makes it, for me, a real time when thinking hard about policy and what we should do, as well as operations and how we should manage, is enormously important. And now I'm going to test my technical skills, and it worked. So this is why I'm thrilled to be here talking today about my book, Reforming Child Welfare. There are really two reasons that I hope you might care about what I have to say in my book. One of them is that you may care particularly about the topic I'm writing about, vulnerable children, children who've experienced abuse and neglect, deeply poor and vulnerable families. But the other reason is that there may be people in this room who aren't interested at all in those policy areas, but who care a lot about what it takes for government to succeed in dealing with very tough, intransigent issues. And just out of curiosity, how many of you have a special policy interest in the child and family arena? Just rough show of hands. Okay, and how many of you are more in this category? You're interested overall in how government works. Okay, a lot of people didn't raise your hands either time, so I'll just have to persuade you that there is a reason to care, other than that this is a place to be out of the rain. But it sounds as though there are people in both categories, and I will try to speak to both. Just to give you a little bit more about why you should care about both categories, I just want to say why reforming child welfare really matters. Public child welfare systems are those systems that deal with reports of abuse and neglect to children and then figuring out what to do. Can children stay with their families? Can they be safe there? Do they need to be removed to foster care? Can they be adopted? Should they go home? And they're the last safety net when kids' families can't support them. But the headline I want to say here is that this isn't just some tiny fringe public service. It's actually quite big. About 3 million calls in the most recent year reported, of which about 2/3 were assessed or investigated. About 47 children per 1,000, about 5% of kids have at least that level of contact with a child welfare agency. So it's not tiny. And about 500,000 children are in foster care on any given day. 1,800 children or so in 2007 died due to abuse and neglect, and that number has actually been rising, although the tracking of it may be a little bit uncertain. And then the other side, so you should care about these kids, but you should also care about government performance and reform more generally. As you can tell, those are sort of rhetorical questions. Are there other settings besides child welfare where public trust is eroded? Oops, I pushed on something. Public employees feel under fire and results don't measure up. Clearly, to any of us reading the paper, the answer is yes. School systems all over the country. In the district right now, we're in the midst of a series of stories about our metro system, bus and train system, and those characteristics. But all over the country, lots of public conversation is about whether government can really do what it's supposed to do. Are there places where we're dramatically expanding what government does? Well, clearly, the healthcare vote yesterday says, yes, we're going to be trusting government, in particular 50 state governments, to figure out how to carry out a very expansive and complex bill. Let's see, what have I done? I just need to close this, right?
Let's just try that instead. How about that?
Okay. So what I'm going to do in the time I have today is start by talking about the book, and particularly about what I learned both from my own experiences and the other states that I studied, and what that led me to in terms of lessons about managing public agencies and leading them, and also lessons about national policy. But then I'm going to step back at the end for those of you whose interest is not most of all in reforming child welfare, but is in the bigger government issues, and I'm going to say, okay, what are some lessons we can take away for those settings? And I want to begin by saying a little bit about why I wrote the book. And the way to tell you that, I think, is to tell you a story from the very first summer. Summer of 2001, Mayor Williams had just recruited me. As you heard, the context for this was the death of Breonna Blackman, who was killed because a judge sent her home and her mother's roommate killed her. It led to huge turmoil and in the end led to the federal court being willing to work with Mayor Williams to give the agency back to the district. And Mayor Williams recruited me to come and try to run the agency and turn it around. And the story that I always think about when I think back to that first summer, it's about 10 o'clock one night, and I'm sitting with several of my senior staff in the office of one of my colleagues, and we're sitting there with this terrible feeling because we know that yet again, one more night, we're going to have about 20 children sleeping on cots on the first floor of our office building. And this was a group of people that I'd hired who were smart, they knew the research. If anybody in here knows anything about child development, it's hard to imagine doing something much worse to a child who's been through the trauma of abuse and neglect and through the trauma of being torn away from their family, than to put them on a cot in an office building with no idea where they're going to be sleeping the next day, with no idea who's going to be there for them. So we knew it was not the right thing to be doing, but we also could not at that moment find anything else to do. We were on the phones calling foster parents, trying to figure out something else to do, and we weren't succeeding. What happened? Well, in the end, it actually took me way longer to fix that than I thought it would. It was something that took me almost 2 years till there was never again going to be a child spending the night in our office building. Why was that? Well, it turned out that it was because there were so many layers of reasons that every time we fixed one, another one came up. Social workers might get so frustrated with the system that they would just wait. A child might be with a foster parent and it wasn't working, but the social worker didn't think anybody would listen to them, so they waited till it blew up and the foster parent brought the child to our building. The police contributed. They might drop a child off at night. And even our contracted agencies we worked with to provide young people a place to stay, our rules, which seems insane in retrospect, let them say that if a young person came back after curfew, they couldn't come into the program, they'd come dump them off in our building. And many, many other reasons. Every time we fixed one, there was another. So why did I write the book? In the end, thank you. I really wanted to understand how it could happen that good, caring people with the right values who knew a lot, our social workers were master's level social workers. They often knew a lot about what was good for kids, but they still couldn't fix this kind of complicated, multifaceted problem. So I wanted to figure out, what does it take to do it? Why is it that it's so hard, even when people share in an overall way the right values? And what do you do about it? When it is hard, do you just give up? What can you do? And then, besides understanding that in child welfare, I did sort of think that learning about that would help in other settings as well. And as you'll see at the end, I also really believe this work is incredibly exciting and important. And I wanted to talk about why it matters and why big policy and legislative decisions aren't the only thing that matter to results. In order to achieve those goals that I had for the book, in order to understand why those problems, those tangled problems came up and what to do about them, my story about DC was valuable because I knew it from the inside out, so I could talk about what it felt like, but it certainly wasn't going to be enough. Everybody was just going to say, but that's what you think, it's subjective, plus everybody knows DC is different. At least they think they do. Turns out that sometimes it isn't. So I looked for other case studies. I talked to experts around the country about other places where terrible child welfare systems had been turned around. I did extensive interviewing as well as looking at documents in those settings. And then I looked at research. And as you heard, I was interested in policy research about children and child welfare, but I also looked at some management and leadership research, much of it in the private sector as well as public, that had application. And then I drew on my own national experience. I had overseen child welfare as assistant secretary in the Clinton administration for the whole US, and I looked at national data where that was relevant. So what did I find out? There are lots and lots of specific things that my book gets into, but I want to start with two overarching lessons that I think are particularly important. And the first one I framed here as the first myth. very frequently, when you read about any public policy problem, but particularly when you read about troubled agencies, just take a look at the article or listen to the TV report and see whether the implied idea is that there's one simple, single-dimensional thing that you could do to fix it. In child welfare, it's often if we brought down caseloads, if we didn't have these social workers who are so mushy and we had somebody tough, if we had more money, if we had political will, or whatever. There's one answer, if we had a different leader. In fact, that's not the case. Failures are complex, they're multifaceted, there are lots of things wrong, just like having those kids in the building. It wasn't just one reason, there were many reasons, and so the solutions have to be complicated as well. But the second myth is that, okay, so maybe it's hard, that must mean it's impossible. But that's not true either. It is possible to have big changes, to have major reforms that make a difference to large numbers of people, but the strategies have to be multifaceted and complicated themselves, and they have to be persistent. So my method in the book is to look at successes and try to see what we can learn from success that would help us do better in the future. What do I mean by success? There's a lot more about this in the book, and we can talk about it if it's a topic of interest to you in the questions, because sometimes people really want to understand, how sure can you be about improvement? And essentially what I would say is that in all three of the sites, Alabama and Utah actually have had also federal court orders and have now emerged from them after well over a decade. The district is still under it, but much better than it was. In all of those, there were big improvements from a horrible baseline. So that doesn't mean that any of those programs got to the point that you would want as your ideal, but that on basic measures, like are any children ever visited? The programs went from, in our baseline review in the district, we were probably seeing about 5% of the kids across 5 or 6 months, to, by the time I left, it's better now, probably seeing 50 or 60% of the kids each month as getting closer to what we were supposed to. Investigations, case plans, big improvements on some key measures of quality, and on some results. Nationally, the book also talks about national successes, and those are important because it's important to think about how in some of the services that we think of as just uniformly dreadful, we've actually made really, really big changes. Oops, I leaned on it again here. Yes, you can tell me where I should turn that off. Okay, I'm going to go back once and then come to it. When children have to be removed from their homes, their parents can't keep them safe, and they stay in foster care, one of the big things that we know from research about young people's development is that permanent homes really matter. So it's really important, if we're going to have a positive effect on children, that they should either go home to their parents if the problems that were underlying in the family have been solved, or perhaps to a relative. Guardianship is the current strategy often for enabling a child to have a permanent home with a relative, or be adopted. The worst outcome for a child is to be in one temporary setting after another and just never have a home or people committed to that young person indefinitely. Nationally, we made a very big change in that, which began in the Clinton administration with a commitment to doubling adoptions, and that goal of going from 25,000 kids a year to 50,000 being adopted from foster care was achieved in the early 2000s. That's a very large number of children. That's 25,000 young people each year having a far better outcome than they did before. So the message of these successes is big changes are possible, so let's learn about how they happen. At the same time, and all of you in this room who pay attention to child welfare issues won't need this slide, but just to reassure you that I'm not Pollyanna about where we are, there are big problems left. Nationally, we've had successes with adoption, but we haven't yet made an impact on helping kids go home in a more timely or safe way. We haven't done everything we should about the settings kids are in while they're in care. And remember, I told you that the number of kids dying from abuse and neglect is actually increasing, at least based on some imperfect measures, and the other measures about safety aren't great either. So we've got a lot left to do. So the method of the book is to try to say, if we look at where we've had some success, what can we learn that could help us deal with these big problems? So what the book does is plunge in a lot of detail to what was the experience in the district and what were the experience in these other settings, and then try to say, what is it that we can learn about how success happens if we look at their turnarounds? So I looked at the turnarounds in Alabama, in Utah, and in the district, and found 5 big themes. Each of those is at least a chapter. Some of them go over into more than one chapter, about what made the difference. Vision and strategy, information, learning, and performance management, a strategy for the political environment that changed the outside world, leadership in the agency, and then change on the front lines, social workers, foster parents, people who worked with children. In these remarks, I'm going to just focus on vision, information, and leadership, but I would be delighted to talk about the others when we get to the Q&A. So vision. That's a quotation from the Utah director saying that you had to have vision. Before that, there were tons of ideas. I think in our conversation in the class this morning, somebody talked about all the different ideas about how you could do the job well in an agency you were volunteering in. And here, Richard Anderson is saying having zillions of ideas isn't enough. You need a shared vision of where you're going. Now, when you think about private sector management literature, or when you think about what's probably in your heads about leadership, this may seem kind of boring. Everybody knows that vision is something you should have. But the interesting thing is that for those of you who are thinking about research or policy from an academic perspective, that's actually kind of the opposite of how researchers and policy thinkers usually think about it. They usually think about it as, let's list some specific problems, let's go look for an evidence-based solution to each of these problems or a program that's been evaluated, and then let's list them and put them into effect. But none of the successful leaders acted that way. They didn't say, okay, I have these 17 problems, let me find a program for each one. Why not? Well, one answer is that they had very complicated environments. They were trying to persuade social workers and outside agencies and their bosses and the police and the mental health agency all to move in the same direction. And so they had to be able to tell people where they were going. Even if they had programs after that, they had to be able to say, we're going to an agency where kids live in families, not in institutions. Or we're going to an agency that will keep kids safe and that will work in a different way. And so even though it's not exactly what researchers would say, having that overarching vision was clearly how the successful leaders operated. Now, one of the interesting questions then is there just one vision? Comes up a lot if you read the papers on education reform, for example. Is it just key that you have a philosophy for a school or a district, or is there a right answer and everything else is wrong? I thought about that a lot in my sites because the experts I talked to early on were very divided about that. Some people thought there's only one right way to do child welfare reform, and others thought there are multiple ones. First, I looked at the research, and I concluded that when you look at research evidence about kids' development and about child welfare, you can get some pretty strong hints. For example, you can find out what's bad for kids. Moving kids around 12 times in a few years that they're in the system, I think we can be sure from the research that that's bad for kids. But you're not going to get really specific answers about the right thing to do in a particular state at a particular time in order to make things better. The research gives you help, but it doesn't give you all the specifics. And then I looked at the case studies, and I found these interesting divides in what people said. Some people, the plaintiff's attorney in Alabama was convinced that the way they did it in Alabama was a cure. It was like a cure for the polio vaccine. You should do it everywhere. Other people didn't think that. I looked at the evidence and I said, no, that's actually not how it worked. There were 3 quite different strategies. They had some things in common. For example, they all thought that social workers should be able to do high-quality work and should have the supports they needed. But in Alabama, they were worried that their old system was way too rigid and people were making bad decisions because it was so rigid and narrow. So they tried to create more flexibility and independence. In the district, chaos was the problem. Very high caseloads, chaotic situations, cases falling between the cracks. So we focused first on fixing that. In Utah, that was their first stage. They hired lots of people to fix the chaos, but then they had lots of new people who didn't know what their jobs were. So they did a lot of work on articulating the policy and the training. So the visions were adapted based on what was going on in the settings. What was shared everywhere, though, was a piece of the vision that was about what it means to be in this agency, what we're like as an agency. All of the leaders thought that and conveyed that. Part of the vision was that we're going to be an active agency, we're accountable, we're not a victim, we're just not going to complain that we don't have what it takes to do it, we're going to take responsibility. So that was a little flavor of what's in the vision and strategy chapters, though there's lots more. Information and performance management. Now this one is interesting because, again, if you were reading what people say who've studied performance in the public and private sector, you would find a lot of people who say this. Counting and measurement performance indicators really matter. But people are very skeptical that that could apply in child welfare. I was skeptical at the beginning. I thought, well, maybe it's just me in the district, that I've walked into a place that feels like a data-free zone was the word we all use, and that I like to work this way. But it turned out that that was something that in every site people emphasize. The first quote here is from New York City, the second one is from Utah, and the third one is from Alabama. Now, in a field like child welfare, where you're dealing with very vulnerable people and hard to measure dimensions of success, it's certainly true that everybody worried about using bad measures. Nobody wanted to create bad incentives to count the wrong thing. But the direction that took them, particularly in Alabama, and then they were the innovators, everybody else adapted it, was to creating new ways of measuring. In Alabama, they created a qualitative measurement strategy, being able to go in and talk to key people in a small sample of cases and really understand what was going on. When I was at HHS, we actually adapted that for the way the federal government would study the states, and then many of the states, including DC and Utah, did that too. But the numbers are key in child welfare, partly because they're the only way you can get successes. If you're not setting goals and achieving them in a way that you define, you're only in the newspapers for the tragedies. And so the measurements were one of the ways of motivating people to succeed. Then finally, leadership, which is a topic we may want to talk about more in the Q&A. I was very struck by the ways in which people exercise leadership in these settings. Again, you might say it's obvious that that matters, but if you look at what people said about Paul Vincent, who was the leader in Alabama at the beginning, competent, unpretentious, undefensive, those are maybe not the words you would think of as what goes with a grand, dramatic, charismatic leader. And in fact, in all of these settings, the leaders were people who combined the ability to motivate and articulate goals with a lot of ability to get things done on a day-to-day basis. And that was not surprising in these settings. People had been so burnt by years of failure, years of grand ideas that didn't go anywhere, that they weren't very inclined to give their trust if they couldn't see something actually happen. And so that was the nature of the leadership there. That's a whirlwind trip through what's 5 big chapters in the book, so I would love to talk about all of those some more. But let me also spend a moment, particularly given what happened in health reform yesterday, about changes in national policy. And one of the things that struck me as I worked on the book, I had many different colleagues and friends who I talked to about it or who I shared it with, and I was very struck that some of them said, why in the world are you interested in these state agencies and in the people who work in the agencies? Yes, leaders can do things, but nothing can ever get done unless we transform how we do social policy in the United States. And then I would have other friends who said, why are you even going into policy at all? You know, everything is about whether you do it well or badly in the local level. And I realized in the end that I actually very much believe both. I really believe that for our public policies to work. We need strong, capable people making institutions as effective as they can be. And those people can do their work even better when national policies support them. So I worked backwards from what I saw in those settings, and I said, what are the things that we didn't succeed on in these settings, and what could make a difference if we could do it at the national level? I have 7 recommendations. I'm just going to talk about 1 or 2 of them here. But you remember I said that we've succeeded a lot nationally on helping kids move to adoption, but we haven't helped very much in helping kids go home. That's because of 1 and 2. We haven't, at the national level, done very much in terms of spending money on kids' own families compared to what we've done on adoption. You remember I said that safety is an unfinished agenda, so I have some national proposals there. And some of the others are about what could happen at the national level that would help address some of the biggest challenges that leaders face locally. I'm just going to talk here a little bit about 2 of them. You saw that that first recommendation was that we ought to be spending money at the national level on preventing child abuse and neglect and on helping parents address, treat the problems that are challenging in terms of how they are able to raise their kids. And I want to say a little background to this. For those of you who don't specialize in child abuse and neglect and child welfare, probably the first thing you think of is that we shouldn't wait until something really bad happens to a child before we try to help that family. It's kind of a common sense way of thinking. But it's been a very hard way of thinking in the United States. We haven't, until now, had any kind of national access to health care. We should spend more money here. Let me try to understand from the research where I think there are opportunities that would make a big difference. I picked out those 3, maternal depression, parental substance abuse, and early childhood programs that try to work with the baby and the mother together, mother or parent. And I picked them out because there's good research evidence that they make a difference. There's very good evidence that there are huge areas of need. That is, that kids who get into child welfare, very often what's going on in their families is an array of mental health and substance abuse issues that nobody dealt with earlier, that the parents face. And that we know a lot about what to do, but we haven't gotten it out there to these families. And in the book, which of course was written before national health insurance looked as though it would pass, I have a lot of ideas about how to get these things to happen. Now, since it's been looking likely, I've really been thinking and doing some other work on now. I said fingers crossed here because I wrote this slide before yesterday's vote. Now that it looks as though this is going to happen, what it means for these kids and these families is that in most cases, parents in low-income families, as we implement it over the next few years, are going to have access to health and mental health services. And there's a whole lot of steps before those services are the kinds of high-quality, research-tested programs that could make the most difference. But at least as states think about what they're going to be doing for low-income parents, basic health and mental health services and treatments are going to be part of the package. So this one, I think we have a big opportunity to make a difference on. I'm only going to touch on this, and then we can come back to it more in the questions. I did conclude, as I thought about what I'd written, that we really have to think about the basic safety of children, even though many of the reformers in child welfare are worried about that, because they're worried that if you think about safety as a goal, it's just going to mean removing more kids from their families. And we know that that doesn't necessarily make them safer. If you have a flood of kids coming into the system, it may not do as good a job with them. So I did some reading in some other fields, in particular in health. There's been a lot of research on what are the right ways of trying to reduce deaths, for example, due to medication errors, deaths or injuries in hospitals. And what I learned from that research is a couple things that are really different from child welfare. One is that there's been a big emphasis of not blaming individual people, but trying to look at systems. And the famous quote, the Institute of Medicine quotes James Reasoner as saying that if you keep blaming or trying to retrain individual people who make mistakes, you're swatting the mosquitoes, but you're not draining the swamp. And what he means by that is if somebody gives the wrong prescription, sets the machine wrong, does something wrong in a hospital, that one person is not the only person who will ever do it. You have to try to understand what about the hours people were working, the techniques, the systems made it happen. That's the opposite of what we do in child welfare. In child welfare, we normally fire or retrain somebody and don't pay attention to what's going on more broadly. In order to do that well, you have to look at a whole lot of experiences and try to study them. And so in the book, I do propose focusing at a national level on trying to learn some lessons from the children's injuries and deaths and what puts children in unsafe situations. And I actually think that might lead us to some of the same places as my first recommendation about ways of addressing substance abuse, mental health, and domestic violence in particular, but I don't know that. You'd have to do the look to be sure. So that's a whirlwind tour through some of the things that I learned about child welfare, which I would love to talk about in the Q&A. But I promised that I would also talk to those of you who aren't specially interested just in vulnerable kids and families, but who care a lot about other public issues, whether it's the environment or healthcare or public transportation or education, and you want to understand what's here for me. And I've been experimenting a little bit with that, with trying to draw out of my own thinking what is useful. And one of the things I just did was have on the WashingtonPost.com site a commentary, an op-ed, that offers some advice to the new person who's coming in as the acting head of Metro. Now, I don't know how many people here travel on our Washington, D.C. Metro system typically. Anybody have firsthand experience? Okay, some do. Not everybody's only in Baltimore. Well, as you probably know, if you read the Post or travel on the system or watch the local TV, it's been a very, very tough last year or two. A fatal accident with multiple fatalities, a number of workers who have died in fatalities on the tracks when they've been working and run over by trains, a great deal of problems with on time, with customer service, and really an atmosphere. I was getting to the point where I was feeling it in the pit of my stomach. Whenever I read an article about Metro, it was sort of, I remember what that felt like, to be trying to come into an agency that everybody had concluded was failing. Morale inside is usually hopeless. Outside, everybody's trying to score points and undercut. What do you do? So I gave some advice. I argued that it's a really good idea to learn what's wrong at the beginning and make it public. That's partly because a new leader coming in has an extraordinary window to be completely open and honest, and it wasn't your fault. And you can't make things better without learning what's wrong. You've got to do that in order to fix it, and the beginning is one of the best times to do that. Despite that, people who come in always feel as though they want to make things rosier, but it really doesn't help you, because if you make things rosier than they are, then you have to improve them by more than is realistic. So that was my number one advice. My second advice, which is something that I talk a lot about in the book, is that when an agency gets to this point of failure, the outside politics and what's going on with staff inside make a big cycle. Outside, they're saying the agency's horrible. Inside, people are getting defensive and paralyzed, and they just don't want to do anything because then they might be blamed for it. And you have to interrupt that both through your own modeling, how you can operate, and by trying to do some unexpected things. For example, announcing something you're going to be able to accomplish, taking responsibility for it in a way that's opposite of that defensiveness. And my other lessons were that in order to change that culture, you have to build a team. My leadership chapter talks a lot about the fact that doing this work is beyond one person. You need a group of people. And then you have to measure constantly. We've talked a little bit about that. If you're ever going to succeed, you have to be figuring out what to track that you could succeed at. And that's part of how you turn things around. And then I do say, and Dr. Myers was telling me this was risky to say to all of you because it might undercut your passion and interest. These jobs are not fun every day you're on the job, right? And I talk about that a lot in the leadership chapter. And the reason I talk about it is that many people who try very difficult turnaround jobs believe that if they were succeeding, it would be fun. So when they're having days when everybody is dumping on them the anger that they've built up over 5 years, and staff you're changing things too fast for some and too slowly for others, your management team is fighting with each other and blaming because they're being caught in the middle of this, and you find it really hard, many people say that means I'm failing. But it actually doesn't necessarily. You can't know if you're failing till you give it some time and look at the results and at what's changing. And therefore, it's interesting, this is a myth. The idea that it's fun is not something that researchers have supported. They've looked at what's really involved in leadership and what personal capacities do you have to deal with stressful and distressing times and get through them. But I think people often impose their own expectations on themselves, and that's a reason that sometimes people who could be terrific at this work give up a little bit too soon. So I am, in fact, an optimist. I believe that even if it's not fun every day, it's extraordinarily satisfying when you get to the point that you look back and you see results and you see a group of people you've become close to because you've all accomplished things that people told you could never be accomplished. So I would certainly not say to the Metro director that it will never be fun, just that you really have to think at the beginning about what you're going to be able to do. So my closing question, it's not the right transition from why some of the days may not be fun, but I guess I want to ask everybody here who's thinking about your life and your career in public policy, what you think is your way of creating change in the world. When I wrote the book, I said at the end that one of the reasons for writing it was that as a new president was entering, as there's new hope about what it could mean to make a difference in public policy, I wanted to persuade a few people at least that in addition to the important contributions you can make by analyzing numbers for a member of Congress or thinking about big picture policy, that there are really, really valuable and creative contributions to be made by taking on large and difficult public services, public agencies, and making them work. And I do think that the health reform vote yesterday is a prime example. Even at the point where the president signs the legislation, that's the beginning, not the end, of a several-year process to take those ideas and those requirements in the law and actually change what happens to a low-income person in Mississippi, in New York, in Illinois, in Arkansas, in Oregon, when they find themselves in need of health insurance and health care. And that journey, figuring out how to make it happen, is to me just as exciting as that initial journey to passing the law. Thank you.
Time for questions. So, last question.
I had the child welfare system. I was a case worker for Baltimore City.
Oh, you were?
Yes, yeah. And I know that it's not necessary for every child to be in care the family to be poor. It could be a well-off person. Mm-hmm. Are there any statistics as to what percentage of the children in care are poor or without resources?
Yes. I mean, there are a variety of studies. And I think the headline is that there is a big overlap between poverty and, I mean, there are, of the children in child welfare, I shouldn't say overlap, because there are obviously very large numbers of poor families who never encounter the system. But the families in the child welfare system are disproportionately poor, and there is lots of research about why that is, because there are a whole lot of different possible reasons. One reason is that poverty, and particularly extreme poverty, in itself can make it really hard to provide for children. That's not supposed to be a reason for bringing a child into care, but sometimes if there's for example, being homeless can stretch somebody's capacity to care for their kids to the limit, so that's one reason. A second reason is that sometimes some of the issues facing parents are both leading to their poverty and their involvement with the system. For example, I always thought that in some of the settings where a mom was involved in substance abuse, she was abusing drugs or alcohol, her family, often her mother and her sisters, were often people who were working really hard at low-wage jobs, successfully taking care of their kids. They would take on her kids too. But the other things that were going on in her life, perhaps domestic violence or substance abuse or depression, were making her unable to care for her kids. And the third argument, and I actually think all three of these reasons are true, is that poor families get more scrutiny. They're more likely, you know, at the hospital, the doctor, the people watching after birth are more likely to assume that there's something bad going on. So many reasons.
Yeah. Also, personally, I think that when I was working, a mother would be, or a father, they don't have the money to provide food, but that's considered neglect, and they don't have enough nutrition because they don't have the money to provide for it. Also, another question about mental health, actually. Mm-hmm. I know children, when they go into care, they get mental health benefits. Is there a scenario with the parents getting mental health benefits from medical assistance? Because I know they deny a lot. Medical assistance is not benefits.
Those programs are state, although now we have a national framework. But what you've said is a very accurate description of most of the country. If you're lucky, children who come into care will receive some services themselves. They're certainly theoretically eligible for services. The quality and the ability to provide kids with mental health services is very uneven. But for parents, for low-income parents, child welfare agencies are required by law to do something. There's a federal phrase called reasonable efforts, which says that child welfare agencies are supposed to try to do something for the parent to address the issue that brought the child into care. But the dollars available are often extremely skimpy, and it's very likely that there won't be much more than parenting classes. I mean, it depends where you are and what's happened, but the reason that I really recommend a big focus on more intensive and longer term services, and services that begin before the report of abuse and neglect. Because I guess to sort of go back to the issue of a mom who might be abusing drugs or alcohol, I always found it incredibly sad when it was clear she had been trying for 3 or 4 years to do right by her kids and not have her drug habit interfere with the kids, but everybody else in her family, she'd been dropping the kids off with them to take care of them, and they all finally got fed up, and she was at the end of her rope. If we'd been able to have real services there earlier, I actually think that that's a way of making a big difference as well. Yes, in back, and then I'll come forward. Go ahead.
You mentioned that in Alabama they changed their way of measurement, which then the state followed. Was it for performance or accounting for children in need of services? And overall, how did they change their standards for measurement?
Glad you asked that, because I think this is actually a really interesting thing that has value for other fields. They changed their way of measure. They added a new kind of measurement that would help them understand if they were doing a good job or not. So it was about performance. And what they did in child welfare, there's been big progress in quantitative measures in state information systems, because Congress has put some money into that. So it's not perfect by any means, but there's better information than there used to be about sort of numbers of kids and services and where they are. But there had always been this big gap of, okay, what you really want to know, there's some things you want to know about the quality of what you're doing and about whether kids are really safe, whether they're how they and their families and their foster families view the system, and whether they're getting the kinds of services that could help them in the long run. And in Alabama, because the federal court standards for them were about sort of big picture changes in quality, they said to themselves, nothing we're tracking now relates to the goals we're trying to achieve, so let's invent something. And they went to another field. They went to mental retardation and developmental disability field, which had been doing more work with structured interviews of various kinds, and they worked on a strategy for structured interviews that could be done with a sample of cases. And they used those to decide when a county's performance was good enough that it was in compliance with a court order. And then at that point, I was at HHS. I had a wonderful lead person in child welfare, and Congress told us to invent a new way to measure the states. They hated the old way of measuring the states, mostly because California and New York always complained when we wanted to take money away, which is an example of a political problem that turns into an opportunity, because we said we'd love to find a better way of doing it. We went out, we looked at a lot of what was going on, and we adapted Alabama's. In the years since then, it's been readapted by a number of states and by a number of sort of expert and nonprofit groups to make it more in-depth. So that's, and the thing that I think is really interesting for other fields is that people often think that you can't measure it all if you can't get simple numbers, but actually that's not true. You can find systematic ways to measure that are not just about you know, adding up simple numbers. You were next, and then I think I saw someone in the back. Go ahead.
You mentioned in your book risk assessment measures and their pros and cons in that they provide structure to decisions, but at the same time create like rigidity and lose the connection between social worker and the family. Would you advise like a new CFSA social worker to use a risk assessment measure, and if so, what kind?
Well, the question, can people in the back hear? Questions about risk assessment measures in child welfare. There's a huge research literature on which ones, which I'm not fully expert on, so I won't give you an answer to the which one. But as you say, I have mixed feelings about, not so much about whether to use them, but about whether to think they solve your problem, basically. Most times the individual social worker won't get a choice. The agency will try to have everybody do a risk assessment measure. And my own view is that there are a couple of very big limits. One big limit is that understanding, it doesn't help you fix the problem, usually. That is, supposing you say these parents have mental health issues, that's a risk. Well, it may help you worry, which you should do, but it doesn't get you the services to fix it. And so to me, you should be thinking about the assessment and the services together. Another problem, as you know, that people criticize is that it makes, puts workers very much in a more rigid check off the boxes as opposed to an engage with the family and solve the problem. And one of the most interesting things that I learned was that, remember I said that if you're going to try to make child welfare more safe, you should learn from the health systems, which have analyzed lots of cases to figure out what goes wrong. The one group of people who've done that in child welfare are in Illinois, and they looked at their upfront risk assessment checklist, and they said, you know, the problem, we think this checklist is actually contributing to workers not seeing big problems in families. And the reason it's contributing is that it makes them put a yes-no answer, because somebody said, you know, if we let them say, I need to gather more information, they'll all check that. But their point was, in the initial investigation period, a lot of issues about mental health and substance abuse and domestic violence, the worker's not necessarily going to see. Family, they're not going to have rapport, they're not going to have a plan together to achieve safety. It's very chaotic. So workers were checking off no, and that was preventing people from looping back. So I think my answer to what would I advise is think about your risk assessment approach in a bigger picture context of the other things you're doing to solve the problem, and then make it all fit together. Yes?
You said that often in social policy, the problems are complicated and so the solutions have to be complicated.
Yep.
I totally agree with that. But how do you see that happening? I mean, is it a matter of coalition building of people with different perspectives or in different fields, or is it a matter of thinking about these problems in a different way? Like, how does that happen?
That's a very good question, particularly in a world where complicated is hard to communicate broadly, right? So I don't think I have a single answer. I think I have several answers. One piece of the answer is that times of failure and danger are sometimes times when people are open to the new. So even though I wrote that letter to the new Metro director and said, you know, it's not going to be fun, I actually think that coming in at a time when people don't like the results gives you some opportunity to teach about how complicated things are, partly by actions, not just words, by trying things, by seeing what works partly, by persisting long enough to see something else. And I don't know, other people who know the politics better will tell me if this is right, but I actually think that one of the ways we passed a very complicated health reform bill is that in the end, continuing with what we have now was painful enough that enough people, not everybody, wanted to do something different. So I do think that that's one part of it. And I think that measuring and having results helps you over time because it helps you say, this got done, but this didn't. So it's not perfect and it's not terrible, and here's what I'm going to do to change this. So that's another strategy. I also agree about coalition building in lots of contexts, as a manager, as a political communicator, in all kinds of settings. One of the things that I learned when I was assistant secretary at HHS was that if a problem is really complicated, part of what you want to think about is who are the 10 or 12 different stakeholders that will have different opinions about it and see different sides of it. And so how do you get them to speak to those sides? And there are a lot of different examples of what that could mean. It could mean they're all in a meeting brainstorming. It could mean that they're speaking in some way. And of course, sometimes you don't want to do that. But I've very often found that if people are seeing a problem in too narrow a way, and they won't believe me when I say there are 5 dimensions to it, sometimes I can think about who else might they believe, and that that's a helpful piece of it. You must have some other strategies about communicating complexity.
Those were good for now.
Okay.
One last question.
Go ahead.
In music child services, you usually want to reunite the children with the birth parents. I think that's a goal, but how do you weigh against like the rights and needs of foster parents versus the rights and needs of birth? That's something I always been really curious.
Well, the overall framework for child welfare is about the best interests of the child and then the parents. The foster parents are providing a really important service, but in some ways, it's not so much about their rights, it's about what they can do to support the child. And I think that that question of how do you best think about what a child, when you know that what children need growing up is a family that's there for them, that makes it really hard to think about, to make that decision about when parents can't be there for their child. I think one of the things, and I don't know if this is what you're thinking about, but one of the things that's happened over time in child welfare is we've all started to realize that it's really bad for kids to take forever to make a decision, and we've started pushing towards more permanent settings. Many more foster parents now adopt than used to be the case. And so when a foster parent is potentially thinking about being a permanent home for that child, then they are in a different role. But I don't really think about it as the foster parent's right so much as how can the foster parent best contribute to what that child needs, which might be to link back to their parents. So I don't know, I may be missing the specific example you're thinking of. Okay? Sure.
Well, for those of you who'd like to talk to Dr. Gould individually, I'm sure she'd
Have a
want to
little
do so
while.
afterwards. And we have a little food over here as well, in case you can probably smell it.
Right?
So I'd like to thank Dr. Gould very much for a very